Let's have a look at today's headlines. Today we're speaking to Dr. Dziuban from the Center of Disease Control Namibia. He will talk to us about COVID-19 and Namibia's response. Thank you for joining us, Doctor.
My pleasure.
Now, Doctor, how would you rate Namibia's response to the COVID-19 pandemic?
Well, Namibia really stepped up early and quickly to address the pandemic. We were fortunate that we didn't start getting cases until after a lot of other countries had. I think we were about number 150 of countries in the world that have our first case. So that gave us that extra time, and the initial steps were quite swift and comprehensive and allowed us to really have a long time, several weeks of not having large outbreaks, and that helped get the hospitals prepared. I think we can all agree it's so good that our hospitals had time to get prepared for our doctors and our nurses that we need and we care about to get the right equipment, to know how to use it and everything. So that was really good. And then it's been a long year, it's been tough. We had these spikes in cases, first in Walvis Bay and Swakopmund, then in Windhoek, now spreading to the north and other places. And since the state of emergency ended, it's really more now up to individual citizens and communities to make sure to keep up the response. Some people out there say it's over, COVID's done, but it's not, unfortunately. And now we have a lot of examples in the world, sadly, that are seeing huge second waves. And we don't want that for Namibia. We've come so far, we've gotten such progress, we don't want to lose that progress.
Now, Doctor, the CDC has played a huge role in helping Namibia to fight the pandemic. Can you talk to us about that assistance that the CDC has given?
Yeah, CDC has actually been here in Namibia since about 2002. We're part of the US Embassy. We're an American government agency, but we're a health agency. We're public health, and so everything we do here is by working with the Ministry of Health of Namibia. And because we've been here for so many years working on other problems like HIV and tuberculosis, it meant when COVID came, we were able to use that relationship and immediately start collaborating, planning, preparing with the Ministry of Health, giving the support we can, working together. We don't have our own emergency operations center. I think some people imagine that we do. We're just integrated with Namibia's Emergency Operations Center. We work closely with WHO, with other partners, with the regions, to address this because it's affecting all of us. I live here in Windhoek too, so does my wife, so do my children. I care about my family being healthy just like you do and all the people listening right now. So we're in it together, but we're glad that because of the long period of cooperation we already had in Namibia, we were able to start so quickly.
Now, Doctor, you've talked about a second wave earlier. Do you think Namibia is susceptible to a second wave?
Definitely. Every country is. Unfortunately, at this point in time, there's no country that has any reason to think that they are protected from a second wave. So I do think we have to stay careful. We've seen Europe right now especially, a very large second wave after months of most European countries having it very under control. We're still having cases right now. I personally know 3 people in the last week who have been infected, Namibians. So it's definitely still here. The more we test, the more we'll be able to understand where in Namibia we're seeing the most cases. We've heard a lot about cases in closed settings like secondary schools or prisons, correctional facilities, as we call them here, police holding cells. But that is a place where the virus can get amplified, of course. People are crowded together sometimes in close contact with each other, but it doesn't appear out of nowhere. This amplified virus is coming from the communities around those settings. So those communities need the testing and they need to be careful as well.
Now, Doctor, what is the CDC's general approach towards the COVID-19 vaccine that's on the horizon and Namibia's participation?
Yeah, we are excited to see a vaccine hopefully coming soon. We all want it so badly. Namibia has joined COVAX. It's a collaboration with other countries to help make sure that they can get access to vaccines when they're available. There are none yet. There's no vaccine out there that's been tested and proven to be safe and effective. But we're not waiting for the vaccine before we prepare for it. So one of the things CDC is doing is working closely, again, with the Ministry of Health on vaccine preparedness. When it shows up, it's not just going to find its way to every community. There are steps that need to be taken. We need a plan in place to make sure we know how to get it to people. Who is it going to go to first? These will be tough questions for Namibia and Namibia's leaders to decide. But in the meantime, we can also work together on educating the public, being ready to identify any misinformation. We all know there's been so much misinformation this year around COVID. When there's a vaccine available, we don't need misinformation making it harder for people to access that vaccine. We also just need basic logistics. How are we going to get it spread out to the different regions? Who's going to be in charge at the regional or at the district level of distributing it? So we're already working on those things, even though the vaccine has not been made available yet.
Now, Dr. CDC, what is your estimation? When do you think will COVID be something of the past?
It's so hard to say. If I could answer that, I'd be a famous person. You know, there's no reason to think it's just going to vanish. At the very beginning, we thought maybe it will. Sometimes it happens. Sometimes the SARS virus that first showed up in 2002, related to this COVID-19 virus, it showed up, it was deadly, it started spreading, and then it vanished relatively quickly. We thought maybe this one would do the same. It didn't. And it keeps spreading and spreading. So we shouldn't sit and wait for it to go away. We need to protect ourselves. We need to keep the numbers low. We need to keep our hospitals from getting overwhelmed, all these things. In the meantime, of course, scientists are working very hard on that vaccine. And once we get that vaccine out to lots and lots of people, then maybe we will be able to one day say goodbye and good riddance to COVID forever. But that's going to take some time. So we can't just sit and do nothing waiting for the vaccine to rescue us. We have to take care of ourselves while we wait for it.
Well, thank you very much for joining us, Doctor.
My pleasure.
Thank you for tuning in.